From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. President Trump has nominated Dr. Casey Means as the next U.S. Surgeon General. Dr. Means is a wellness advocate and a former surgeon who stirred up some debate for her alternative views on health and medicine. Supporters say she will bring fresh thinking to a broken system, while critics are raising concerns about her lack of recent medical practice, as she left her surgical residency back in 2018 and her medical license has been inactive since 2024. Now, she does have to be confirmed by the Senate, so this is not a done deal yet. However, we wanted to bring in Dr. Ted Epperly today to talk more about this. He is the president and CEO of Full Circle Health, which is based in the Treasure Valley, and he is also the co-author of the book, Preparing for the Next Global Outbreak. Dr. Epperly, nice to have you back on the show.
Thank you, Jim. A pleasure to be with you.
So let's talk about this candidate, Dr. Casey Means. She is quite well known in the MAHA movement, this Make America Healthy Again movement. Robert F. Kennedy Jr. is an advocate of hers. What do we know in regards to her, and what, if nominated or selected, if she's confirmed, would this potentially mean for our public health?
Yeah, it's a great question and a troubling turn, but not inconsistent with where Donald Trump and Robert F. Kennedy Jr. want to take health, which is to prevention and wellness and a focus on things that are less than scientifically proven nor mainstream. When I heard about this, I was appalled. I was shocked because they had Dr. Janet Neshwaite that was basically ready to be confirmed by the Senate. She had not gone through confirmation yet, but was much more of a mainstream physician. Dr. Neshwaite got removed because of her views on COVID and vaccines for COVID. She was a supporter of COVID vaccines, and she got removed. And so to the point of Dr. Casey Means, I am troubled. She did not finish her residency, which was an ear, nose, and throat surgery. And as you said, she is an unlicensed physician, not having renewed that license since 2024. So it's troubling to me that we have now somebody that is not a mainstream physician, that is focused primarily on lifestyle means to combat chronic disease. And it's a departure from traditional medical practice. The Surgeon General's office is extremely important. It leads about 6,000 uniformed public health physicians across the United States and the conductants of standard public health initiatives. If we now take on a very much an ideologic thinking about making America healthy again by just focusing totally on metabolic disease, lifestyle changes, all of which are important, Gemma. But what does that mean about the rest of our public health approach, about vaccination, about water purification, around basic other public health initiatives? So that is the concern, is that we're replacing a mainstream physician with a fringe physician that did not finish residency, that does not have a medical license, and that's troubling for the American public.
And in fact, in a podcast appearance with Tucker Carlson, she questioned really the necessity of vaccinating babies according to the schedule recommended by the CDC. And Dr. Epperly, she specifically is against vaccinating for hepatitis B. And I'm quoting her here. This is a quote. She says, quote, "It's emblematic of how we are put on the pharma treadmill from the moment we are born in this country for reasons that are very strange," unquote. If people want to question vaccines and they want to question the timing of vaccines for their children, I think they have every right to do that. But I kind of want to be the devil's advocate here for a minute. When we're in the midst of a measles outbreak in this country, it's, I think, fair to say, a little shocking about this person being nominated for this, and then when they question vaccines in general, like the efficacy of them and the need for them.
Yeah, Jim, that's a great point. The vaccination schedule for children is well-established good science. There have been tremendous amounts of studies that have shown that these are both safe and effective for children and the development of safe and healthy childhoods. Why would we go backwards in time to an era where we were more unsafe? This is what science has been able to help us with. Again, it has been totally debunked that vaccines are the cause of more problems than they prevent. And this backward movement to make America healthy again is foolish when it comes to vaccine technology. Now, speaking as a family medicine physician, I'm very supportive of lifestyle changes and management of chronic disease in a way that helps us understand better good nutrition and diet and exercise. I think any physician worth their salt would be in agreement with this. But where this takes the wrong turn is that it starts to really focus on some fringe, unscientifically proven steps towards metabolic disease that is not mainstream science, is unproven. And so now we put a person like Dr. Means in charge of the Public Health Service with an agenda, making America healthy again through unproven science. This is 2 steps backwards, maybe 3 steps backward into the future.
Dr. Epperly, I want to turn now to Central District Health here in the Treasure Valley for a minute. On Friday, they had a board meeting, and one of the things on their agenda was whether or not to continue to administer the COVID vaccine through Central District Health. At their meeting, this was tabled from a 4-3 vote. So I would like, and we should note, you used to be on Central District Health's board for many years. We know that Southwest District Health already made this decision. They no longer offer the COVID vaccine. If this moves forward at Central District Health and a same decision is made as Southwest District Health made, what does that mean for folks, in particular, people without insurance, low-income folks who want access to the COVID vaccine?
Yeah, I'm both troubled by the fact that Central District Health would consider, again, moving backwards in time to limit this vaccine. I am proud of the board, however, for having tabled this on a vote of 4-3. At least they didn't pass it. Here's the issues as I see them, Gemma, that are of significant and serious concern if the Central District Health Board of Directors passes this. First and foremost, it limits people's ability and freedom to choose if they want this vaccine for the betterment of their own health. Where have we ever decided that people should have decreased choice about something that's been proven to be healthy, which the COVID vaccine has been well documented to be safe and to help prevent people getting COVID? There are plenty of groups that would benefit from this, and I'm most certain would want to get this vaccine. Let me just mention a couple groups to you. The immunocompromised, patients that are living with immunocompromising medical conditions, HIV, diabetes, cancer, and post-cancer treatment. Those patients will be helped by having COVID vaccine to prevent serious COVID infection. The second group are those, as I mentioned, with chronic medical conditions. Chronic medical conditions affect negatively the immune system. So why would we, again, limit their choice to get a vaccine if they so desired? And then the third reason, I think you well addressed too, Gemma, and that is that Central District Health is a safety net provider. That means that they have a sliding fee that helps people, especially if they're on tight budgets, be able to get the vaccine for very, very, very low cost. So what you do by taking safety net providers off the table, like at Central District Health, is it forces someone, if they want a COVID vaccine, to go be seen in the regular medical system, where that cost will be much higher to them than it would be if they go to Central District Health. So there's a health equity issue here too, Gemma. And that means that the poor face either increased costs to get the vaccine or they don't get it at all. So they live sicker, potentially have serious complications, morbidities, potentially even mortality based just on their income and their inability to get it. So I see this as being unbelievably short-sighted by the board, that they would even consider stopping this vaccine. Again, it limits people's choices. Why would we do that? So those are my views, Gemma, on this. And I hope that Central District Health and their board of directors really thinks this through. This is a backward step, just as we were talking about earlier.
And Dr. Epperly, talk to us about as they table this decision, at least for now, wastewater numbers in the area are coming in, and COVID has not gone away. If you look at those numbers, Dr. Epperly, I would say it's back.
It is back. Wastewater is a great way to track different viruses and different bacteria. A lot of viruses are shed through the gastrointestinal system and end up in our wastewater. So for years now, the Public Health Department across the nation, not just ours here in Idaho, but in all public health districts across this country, track wastewater, because you can start to determine how a particular illness is in the community. And what we're seeing is a return now, robust return of COVID in the wastewater. In other words, yes, it's a rapidly evolving virus. Yes, there are new variants that are out there, and now they're starting to appear again. Now, the good news is people have quite a bit of immunity for certain types of past COVID viruses, but it so rapidly mutates, Gemma, that this could portend another wave of infection in people here in our community. So again, this isn't something that stopped. It's not something that's gone away. People need to pay attention to this. Hence, to tie to the point that we were just talking about the importance of COVID vaccines, is that especially those that need it, chronic diseases, immunocompromised people, we should not limit their opportunity to get a vaccine.
And speaking of vaccines, Dr. Epperly, Moderna has a combined COVID and flu shot that there was a published the results of their phase 3 clinical trial in the Journal of the American Medical Association. They just published this last week. And what it says is that this combo, so COVID and flu shot, outperformed the existing standalone vaccines for both viruses. So I think that might be some good news, right, Dr. Epperly? Instead of having to get two shots, if people choose to get the flu shot and the COVID vaccine, there's the potential that there's one shot. So can we start there? And can you talk to us a little bit about this, what we know about this combo vaccine so far?
Yeah, it's really an important breakthrough. We always thought that why shouldn't you be able to put the two together and save somebody an injection, and we can put flu together with COVID and give it in the fall to help protect against both diseases. And so this study was done on 8,000 people aged 50 and older, and it showed just what you said, that not only was the combination more effective, but it was 20 to 40% higher in regards to the antibody response by having both injected together. And their thinking is that by having both the flu virus and the COVID virus, and having that being reacted to by a cell, was that the immunity, the immune response, the antibody production was more robust in the human body by having those two together than either one alone. So not only can we save people an injection by pairing the two up, but we'll even get a synergistic response in that you're safer from both COVID and flu by getting them that way.
And Dr. Epperly, speaking of this, I want to go back to something you and I talked about last week. And this was Health and Human Secretary Robert F. Kennedy Jr. wanting to start this placebo against any new vaccine that comes out, that you would do this placebo testing. So this combo of vaccine is a new vaccine. It just got finished with its phase 3 clinical trial. Let's say that this is ready to go to market. How does what Kennedy want to do impact the potential availability of a vaccine like this?
Yeah, it's a really insightful question. A phase 3 trial means that there is a placebo arm of this. So in some ways you could say, well, it is placebo tested. That's what a phase 3 trial does. So, I don't know if this is going to be something that would fall under the umbrella of passing the Robert F. Kennedy Jr. test for placebo trial or not. If HHS and Robert F. Kennedy say, well, no, now we need to slow it down further and do another placebo trial, then it will absolutely take this off the table for a longer period of time. But you see, that's what the state of the art already is that we are using placebo testing. That's what the FDA requires. That's what the science requires, is to make sure that this is both safe and effective for people. I just want to make one other comment, Gemma, on this, so that our listeners are clear on this. The COVID vaccine that was used was the Moderna version. That is a messenger RNA vaccine. The influenza was our standard influenza vaccine. It is not a messenger RNA vaccine, and there are no messenger RNA influenza vaccines at this point in time. All of the flu virus is still derived in this country by production in eggs. So it's a much, 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 much slower process to get a flu vaccine. That's why if placebo testing for a flu virus starts to become a big deal, it's really going to slow down both the production and the delivery of the flu virus. The good news with this study is that, one, it's already placebo tested. Number two, the combination will save people an injection each fall. Number three is you get almost 20 to 40% higher antibody response by the two together than either alone. This is a remarkably good breakthrough. And I hope, I really do, I guess we're going to determine what RFK Jr. and the new Surgeon General are really about, because they should jump all over this and they should really broadcast this broadly, that this is good for the public's health.
Well, Dr. Epperly, we so appreciate your time and your fact-based information. We've been talking with Dr. Ted Epperly. He is president and CEO of Full Circle Health, based in the Treasure Valley, as well as co-author of the book, Preparing for the Next Global Outbreak. He's been filling in for us, for Dr. Pate, as Dr. Pate takes time away. If you have a public health question, make sure you send us an email, idahomatters@boisestate.edu. And that'll do it for this episode of Idaho Matters. Thanks so much for listening. And just a reminder, you can find all of our episodes wherever you get your podcasts.